Hi, my name is Gilbert Quintero, and I'm currently working on a school project with two friends. And part of the project consists of interviewing someone who we think is successful. I was wondering if I could please schedule an interview with Dr. Tran.
Let me check if she's available for you, and I'll come back with an answer.
Thank you.
Hello?
Hi.
Okay, you're scheduled to see her on May 36th at 12 o'clock.
Oh, that sounds great. Thank you so much. Okay. Hi, Dr. Tran. Thank you for seeing us today.
Hi, Gilbert.
Hi, my name is Carolina.
Hi, Carolina.
Thank you for allowing us to interview and taking time off your day. Let's begin by hearing some background information about you.
I'm an optometrist here at this office. We've been here for 10 years, and we do general eye exams, contacts, a lot of eye problems. People come in, walk in with eye problems, so we do their eye exams. And I have two kids, two daughters, a 5-year-old and a 2-year-old, and married, and just have a lot of fun with our kids, and we really enjoy it.
Well, thank you for that interesting background information. Let's get started with the interview. When did you realize that this is what you wanted to do?
When I was in undergraduate school, I attended UC Irvine, and my second year I worked for an eye doctor part-time, and he was kind of my mentor, and that's how I became interested and proceeded to finish my degree at UC Irvine, and then and all the prerequisites to apply to optometry school, and then I went to optometry school after that. Yeah.
Was there ever a time in your life when you weren't sure about what you wanted to do?
Well, yeah, of course. You know, you always think about, if you had a different choice, but I'm glad I made the choice because I really enjoy working here and doing what I do. But, you always think of if you took this major or this, you could have gone to a different school or different route and your life might have been different. And I always think if I didn't go to optometry school, I wouldn't have met my husband and had my two wonderful kids. So, what if I didn't go? I wouldn't have this life. So it's kind of interesting that you pick something and, things turn out. And it's good.
Were there ever pressures from family or society telling you to be something that you didn't want to be?
I grew up in, I was born in Vietnam, and we came over to America, and we immigrated to America when I was 5. So I grew up in a very poor family, from another country, and we didn't have very much coming here. So they were always pushing me to study and get good grades and go to college and get your degree and get a good profession. So that's always been implemented when I was young, like in elementary school. My parents were very strict. And, they're older generation, so they always think, you gotta be a doctor. You gotta be a doctor, you gotta be a doctor. So yeah, I was always pushed to do that, to go towards that profession. And there's different fields in medical, I just happen to be interested in optometry, so yeah.
What was the most rigorous obstacle you would consider would probably stop you from getting where you're at today?
I would say college. It costs a lot of money. Yeah, so if you don't have parental, financial support, you really have to try for scholarships, financial aid, and if you have to go that route, which I did for graduate school, I took out loans, but that's an obstacle if you can't. You don't have to depend on your family to pay for your college. You can take that out and pay for it, but to some people that's an obstacle.
Yeah.
So, like for undergrad, I had a lot of help from financial aid, so that helped out a lot. So I didn't have to, pay a lot or owe a lot. But optometry school, it's a private profession, graduate school, so yeah, it's gonna cost a lot, so.
What have been the keys to achieving your level of success?
I think it has to do with just personal motivation. You have to be motivated to go to college and get a good college education first. If you're not and you just want to work and get by, then if you're not motivated or if you don't want to, you're just not gonna want to get there.
How do you balance your personal and professional life?
I leave stuff at home, and when it comes to work, I just work. Yeah. Like if I have a bad day or things that need to be done, I try to do it separate from work. Yeah, just focus on the patient and their problems.
Describe a typical day in the life of your job.
I start in the morning, I get off at maybe 6, but I see patients every 30 minutes or less. We try not to schedule patients real quick because we want to spend time with them. And so we see patients every 30 minutes or so, and it's just continuous. And my day is interesting. I don't see the same things every day. I could have somebody come in with something in their eye, and somebody come in with just routine glasses. So I just never know what I'm going to get every day. Yeah. So it makes it interesting, but challenging because you could have everything's going well, and you have people that come in and they have stuff in their eyes or eye infections, and kind of interrupts the normal flow. But they're grateful that you can help them remove a foreign body, so it's all worthwhile. Yeah.
In your opinion, what is the most significant skill you must acquire in the field of optometry?
I think working with people. Yeah. I think you have to work well with people. If you don't enjoy that, you probably won't do well. Yeah. Just it's a very public and service, that you deal with the public. So.
If you had one piece of advice to give young people getting ready to jump into the real world, what would it be?
Keep motivated, look to the future, be inspired to do a little bit more than basic, and don't settle.
Yeah. Overall, do you think that you have built a very successful life?
It takes time, right? I've graduated, I think it's been 12 years now. So, when you first graduate, it's going to be challenging. You're a brand new doctor, and getting your first job, and then getting more comfortable practicing the skills that you just learned in school.
Yeah.
So it's always new first, and as time goes by, you find out what type of atmosphere and setting you want to be in. Like, do you want to work for somebody else, or do you want to have your own business? So you start to figure that out. And some people, they don't want to have their own business, or they don't want to bother and be responsible for it, so they rather have somebody else do it. So once you get comfortable and you find the setting that you like to work in, it makes things easier. And you run it the way you like it.
Yeah, that concludes our interview. Thank you for taking the time.
Thank you so much.
Thank you.
You guys are wonderful.
Okay, so tell us a little bit about what's going on right here.
So this is our one of our exam room lanes, and this is the primary equipment that we use to perform an eye exam. Before we got into this room, we did some pre-testing on the other room, some automated machines. Check your eye pressure, give an estimation of your prescription, your peripheral vision testing, color vision, depth perception, and then when we get in here, we check prescription. This is a phoropter, And we use this machine to check for lenses in a patient's eyeglasses and what they need for a correction for glasses to see better. And in this machine, there's all kinds of lenses. There's farsightedness lenses, nearsightedness lenses, and astigmatism lenses. And we use that method to determine a prescription for glasses. Okay? And it has a near chart. We check distance and reading too. So that's in there. And then this is a slit lamp. It's also another piece of equipment we use to look on the external and internal part of the eye. It's basically a microscope. A patient puts their face here, and then we use the microscope to look at small details in the front and in the back of the eye. And we use lenses, high magnification lenses, to take us to a certain anatomy of the eye. So, for instance, when a patient puts their chin here and we use this lens to look through, it takes us to see their optic nerve and the retina, the lining of the eye. So we can check that too. And we also have some handheld equipment. We check, this is a transilluminator. It's used to check their pupils, make sure they have normal pupils. It's also a test. Pupils actually relate to a neurological function, so that's important. And this is an ophthalmoscope. You might see this at a pediatric doctor's. They use this to grossly check inside the eye. But since we have the slit lamp, it's a little bit better. So we only use this when we really need to. Yeah. And we also use that to determine a patient's prescription when we don't have anything to, don't have any other readings. But we have a lot of automated machines, so we don't use that as much anymore. But it's there. Okay.
All right.